We frequently hear from readers how from the worst of situations comes the best patient care. In this segment of Medical Economics Minute, Frank Gabrin, an emergency physician at Southwest General Health Center in Cleveland, Ohio, tells us how from his painful experience with testicular cancer, he developed a 5-step process to improving the doctor-patient relationship.
The first time I had cancer, I was only 28 years old, and I was just out of medical school. I was in the military, and it didn't really affect me. When it happened the second time, I had already finished the residency. I was sort of the up-and-coming star in the department, and it just rocked my world. As much as I knew about medicine and as much as I knew about being a patient with cancer, still, when he told me that I wouldn't be able to get a falsie, right, I just broke down, right? Like, I totally became an irrational, vulnerable, unable to think logically. And, you know, whenever disease comes or an accident happens, that happens to all of us. Like, we suddenly are not the powerful, secure, self-reliant beings that we normally are. When I began to sob, I was actually uncomfortable as he approached me to hold me, right? But I was so out of control, I couldn't stop my tears from happening. So he held me for, I would guess, probably at least 10 minutes. It seemed like forever, until I finally could stop sobbing, right? And I had gotten snot all over his lab coat, right? And, but just sitting in that place with him and then having him promise me that I was going to get better changed everything for me. Ask caregivers, nurses, doctors, medics, firemen, why they went into this business, right? Why they picked this. And they all tell you the same thing. They want to care. They want to make a difference. The first step is you have to actually get present. You can't be worried about your grocery list or, you know, or the things on your to-do list or the other patient that you just saw that things may not have gone well. So you have to get present. And once you get present, you have to connect. And connection is a real interesting human phenomenon. But usually it starts with just wanting to know somebody's name or something about them. So I usually ask patients to tell me some story about them that will help me remember their name. And you find out all kinds of great information that makes you feel closer to the patient. And then once you understand their problem and you've connected with them, then you have to move into that really uncomfortable place of empathy, right? And actually there's been a lot of research done that shows that the actual experience of empathy causes all the prefrontal cortex centers that cause dysphoria, right, to actually light up. So what happens is, like, you actually does feel bad. It is painful to sit in empathetic connection with somebody else who has a problem. And I think that's where medicine just sort of got off track, right? Because it is painful, it is unpleasant, and we've always been taught that you have to keep your distance, keep your professional distance. Don't get close because it'll ruin your objectivity. You won't be able to think logically or rationally. And that actually prevents the caregiver from actually giving the care, because unless you can feel that empathy and you can have that sort of dysphoric experience with your patient, you can't move into the next step, which is compassion. And actually feeling compassion for, you know, another individual is one of the most great feelings a human can actually experience. It wasn't until I started to do this that I started to get excited about coming to work, right? And I left work feeling happy and energized rather than drained and, victimized. So I think that the best advice I could give would be just try it. Just try it once. Just take that one little step outside of the norm, outside of the ordinary, into the extraordinary, and it'll change everything.